Good morning, everyone. My name is Ninalyn F. Pilawan, and I will be discussing the nutritional and surgical management in this case. Cardiogenic shock is a condition wherein our heart cannot supply enough blood to keep the body function properly. A variety of risk factors can increase the risk of developing heart disease, which can eventually lead to cardiogenic shock. And on this case, patients' past medical history reveals hyperlipidemia, hypertension, and alcohol intake, which possibly triggers the patient to experience cardiac shock. Making lifestyle changes to maintain a healthy heart and low blood pressure is the best way to prevent cardiogenic shock. Diet plan on this patient include dietary approaches to stop hypertension or DASH diet. This diet is a healthy eating plan that is designed to help treat or prevent hypertension. It includes foods that are rich in potassium, calcium, and magnesium. Hence, foods that are high in sodium, saturated fat, and added sugars are limited in this diet. When following DASH, it is important to choose foods that are rich in potassium, calcium, magnesium, fiber, protein, and low in saturated fat. These foods include avocados, bananas, potatoes, dairy products such as cheese, yogurt, and skim milk, beans and lentils, whole grains and dark green leafy vegetables, lean beef, and fish. On the other hand, it is important to reduce sodium by using sodium-free spices or flavorings instead of salt, not adding salt when cooking rice, pasta, or hot cereal, choosing plain, fresh, frozen, or canned vegetables, choosing fresh or frozen skinless poultry, fish, and lean cuts of meat, and reading food labels and choosing low sodium or not salt added options. In here is an example of a DASH diet which may help our 75-year-old Caucasian male patient with regards to his hypertension. For his breakfast, we have 1 whole wheat bagel, 2 tablespoons of fat-free cream cheese, 8 ounces of skim milk, 4 ounces of orange juice, and 1 cup grapes. For his lunch, we have 2 slices of whole wheat bread, 1 half fat-free cheese, 1 tablespoon of mayonnaise, 2 ounces of sliced roast beef, 1 cup steamed baby carrots, 1 fresh peach, 4 ounces of grape juice. For his dinner, we have 3 ounce baked chicken breast, 1 cup steamed rice, 1 cup steamed asparagus, 1 cup sauteed spinach, 1 medium apple, and glass of water. For his snack, we have 1 half cup of unsalted nuts and 1 half cup of unsalted pretzels. According to American Heart Association, reducing the consumption of saturated fat and trans fat is the best way to lower the cholesterol in the blood. On the other hand, fruits, vegetables, whole grains, fat-free or low-fat dairy products, lean proteins, high-fiber foods while limiting red and processed meats, sodium and sugars within food and beverages were all part of a heart-healthy diet in which it helps the patient lower his high cholesterol or hyperlipidemia. In here, we have created an example of a meal plan which help him control his hyperlipidemia. For his breakfast, we have 1 cup low-fat plain Greek yogurt, 2 whole wheat toast, 2 tablespoons of fat-free cream cheese, 1 medium apple, and 1 cup skim milk. For his lunch, we have 1 bowl of kale and avocado salad with blueberries and edamame, 1 half cup of unsalted nuts, 1 plain water, and 1 cup of frozen berries. For his dinner, we have 4 ounce poached salmon with asparagus, 1 cup of brown rice, 1 banana, and 1 cup of pomegranate juice. For his snack, we have 2 tuna salad with smashed avocado on rye crisps, 1 sliced carrot, cucumber, and celery dip in hummus, and 1 cup of grapes. Next is the surgical management. In this case, the patient was treated medically until undergoing cardiac catheterization. During his catheterization, percutaneous coronary intervention was performed, including drug-eluting stents to a 99% stenosis of the first diagonal branch of the left anterior descending artery. What is percutaneous coronary intervention or PCI? It is also known as angioplasty with stenting. It is a minimally invasive procedure used to open a blocked coronary heart artery. In this procedure, a small balloon along with stent or a tiny mesh tube is being inserted into the problem of area, which in this case on the left anterior descending artery to keep it open following the removal of the balloon. Before the procedure, patient was given a sedative to help them relax. In such cases, the hair in the groin will be clipped and an IV line is inserted. If any problem arises, medication will be given quickly. Electrodes will be attached to monitor the heart of the patient and pulse oximeter to track oxygen level in the blood either in finger or on the ear. During percutaneous intervention, an assigned interventional cardiologist who specializes in the heart, blood vessels, and circulatory system makes a small insertion and reach a blocked blood vessels, either in the arm or the groin. Then, using an X-ray that shows real-time image on the monitor along with a contrast dye, a non-harmful solution that appears well on medical imaging is injected and used and a catheter is then threaded through the blood vessel of the heart where the coronary artery is narrowed. When the tip is placed, the balloon catheter with a stent is advanced over the wire to the blockage site. Moreover, the balloon tip compresses the plaque and expands the stent. The balloon is then deflated and withdrawn. Once the plaque has been compressed against the artery wall, the stent will be placed. Nowadays, the majority of stents have coatings that gradually release specific medications called the drug-eludating stent, used to stop the development of the formation of scar tissue in the artery, further ensuring proper blood flow and minimizing the need for additional medical intervention. Additionally, the stent stays in the artery to keep the blood vessel open. Once done, closing of the insertion site is performed to stop the bleeding with a compression bandage. On the other hand, if the insertion is placed in the groin area, patient needs to lie flat on their back for several hours, keeping legs straight. And if a catheter was inserted into the arm, pillows and a stabilizing board will be utilized to keep the arm elevated and keep straight. This procedure only takes between 30 minutes and 2 hours to complete. The precise treatment time is determined by a number of factors, including the extent of plaque buildup. After the procedure, patient is advised to stay in the recovery area for observation. Bruising, soreness in the insertion site is expected. If patient feels discomfort, a pain medication is given, and patient is encouraged to drink water to flush out the contrast dye from the body.